Blocked fallopian tubes. Can you still get pregnant? Hi everyone, I'm Dr. Pranitha Reshmi, Fertility Specialist, Sudha Fertility Hospital, Banjara Hills, Hyderabad. Today let's talk about a question that I hear most often in my OPD. Doctor, నా fallopian tubes block ఉన్నాయని చెప్పారు. Does that mean that I can never become pregnant again? So the answer to this question is no. Blocked fallopian tubes doesn't always mean that is the end of the fertility journey. So first let's understand what are these fallopian tubes and how do they function. The fallopian tubes are like a bridge between the ovary and the uterus. Every month the egg is released from the ovary. So fertilization normally happens inside the fallopian tube and then the embryo travels into the uterus for implantation. So if the tube is blocked, the egg and the sperm cannot meet naturally. Now, not all blocked tubes are the same. So if only one tube is blocked and the other tube is healthy, natural pregnancy is still possible. It's definitely possible. But if both the tubes are blocked, then natural conception becomes difficult. But that doesn't mean that you cannot become pregnant, become a mother. So many patients immediately panic after hearing the words like blocked tubes. So don't panic. The next question is, how was this blockage diagnosed? So usually by a basic test, that is HSG, which is an X-ray dye test. But remember, sometimes the HSG can show a false blockage because of the tubes goes into the temporary spasm. So one report is not the final verdict. Sometimes we repeat the test or advise laparoscopy depending on the situation. Now, what are the treatment options? If the blockage is mild or located near the uterus, sometimes women may benefit from the treatment or with surgery. If the tubes are severely damaged, swollen, or both the tubes are completely blocked, then IVF becomes the best option. Then the biggest advantage of IVF is that it completely bypasses the fallopian tubes. So we collect the eggs directly from the ovaries, we fertilize them with the sperm in the IVF laboratory, grows the embryos and transfer the embryos directly into the uterus. So even if the blocked tubes, both tubes are blocked, the pregnancy is still possible with the IVF. And one more important point is, please don't delay treatment. Age and ovarian reserve are equally important. And many couples, they spend years trying home remedies or unnecessary medication because they are afraid of IVF. So early consultation can save valuable time. So today's take-home message is, the blocked tubes are a problem, but they are not the end of your dreams or becoming parents. So there is always a solution after the right evaluation. If you have the blocked tubes, or if you were told that the tubes are blocked, consult the fertility specialist, understand the exact cause and choose the right treatment. Thank you for watching this. If you found this video useful, you share it. And if you still have any further questions, you can ping me in the comment box. Thank you for joining this Facebook Live, and we'll meet in the next Facebook Live session.